Hi everyone, I'm Steve here again with Dr. Nario. How you doing, Doctor?
Very good, Steve. Happy to be here, and thank you for having me again.
So Dr. Nario is in Reno, Nevada at Biointegrative Health Center. You can easily find them online and see all the different things that they treat. So we're going to talk about cancer today. And you know, I don't really know the statistics, but cancer is something that it it's way up there with like heart disease and diabetes, and I don't want to call it just a nuisance but a killer um, in society, right? That's what I mean. Where does cancer rank compared to some of the other dangers that we face in our lives?
Well, Steve, always the number one enemy would be our famous cardiovascular problem. Heart attack, strokes, and these are the things that we do every day. Sedentary lifestyle, eating bad. But we're talking about the second, maybe now the third. It's always kind of jumping back and forth. Second, third priority on our problem list for our country is cancer, unfortunately. And the thing here is more than one in three people will develop cancer in their lifetime. People over the age of 50 have a 13 times higher risk for cancer than those under 50 years old. And cancer risk increases for everyone as they age, regardless of family history. Sometimes we fall into that framework of, oh, it's actually my family history that did this to me. So this is something now that you probably shouldn't use this statement on because only 5 to 10% of cancers are inherited. Most is what we do to ourselves. And that's
Wow.
why I have a lot of.
Lifestyle.
Yep, that is correct. It's an eye opener, right? That's why I have a lot of patients coming in our clinic to just ask this question: Do I have cancer or not? Help me
All
with it.
right. So we before we turn the recording on, you were talking about a screening that you can do, and mm, I'm sure you have patients. It seems like you expressed that you have patients that are worried about cancer. They want to make sure they don't have cancer, or maybe they just want to be relieved that they don't have it. And so, tell us about this screening that you can do. It screens multiple different types of cancer. Tell us about this screening that you were talking about before we turn the recording on.
Well, let's, Steve, start first with the standardized screening tools that we have in the market. And this is usually the ones that you would hear when you see your regular doctor, and they would say, hey, it's time for your mammogram. It's time for your colonoscopy. It's time for your pap smear. And also, let's check your PSA blood test to see if you have prostate cancer. Or even, hey, let's do some CT scans on your lungs if you're a smoker or not. So those are the only cancer screening tools we have right now in the market. And as you can see, those are like five that I reported to you. But you have to remember, we have hundreds, more than even like 50 more, or even in that range, 50 to 100 types of cancers out there. That what are we going to do about it? We only have five of them that I just mentioned. And that's why even the accuracy of this five is now also being questioned. Like, how accurate can this be? Can this really be? Have you heard of horror stories that, oh, they biopsied my breast and it actually was not cancer? So that patient went through this invasive procedure and all that mental torture just because of, yeah, they thought it was cancer and it's not. And I have patients who went through therapy, also chemotherapy, who really didn't need it. And I'm not saying that's going to happen all the time, but that's my point. The inaccuracies of our current recommendation screening tools are not perfect. That's why there's a blood test that we do, and it actually is gonna. These are for our patients who comes into our clinic, who just ask us a direct question: Doc, do I have cancer or not? And that's where this test comes in. And we offer this in a way that, hey, let's do a blood test. And it was just the result is as easy as a flip coin. It's either a yes or a no. And the beauty of this, it will tell you where the cancer is.
Wow, that's amazing. And it's a blood test. Is this something that you have your regular patients do like once a year, depending
That
on
is
their age, or how do you recommend it, or do you recommend it, or do you just wait for people to ask?
right. Well, the thing here is, of course, you have to remember uh, one issue of this test is this: it's not cheap to do this test. Right now, last time I spoke to the company, they're trying to get it approved by insurance, but right now it's not. It's almost like I think last time I ordered it, it's around $900 to $1,000. And when you mentioned about how often should this be done on patients, it's actually yes, I suggest it once a year if you have that budget of just trying to find out if you want to know if you have cancer or not. But yeah, it's usually the cost that's kind of like the hindering factor here. But don't get me wrong. I'm not going to tell a patient don't do the five screening ways in terms of what the U.S. government recommended us to do, because it's not a replacement for that. It's always going to be something that will supplement this specific test.
Okay, so you're saying that this is something at this point that is not covered by insurance.
Unfortunately, not. It's going to be soon. That's what they told us. But the beauty of this is they have payment plans, different ways on how they maneuver through it. Yeah, but yeah, they have ways.
You know, $1,000, if it finds something, is not very much, is it?
That is correct, and that's the point. My point here is $1,000 versus a lifetime of psychological, physical, and mental uh, quality of like a clear frame of mind, living that you know that you don't have any cancer at all.
Right. And
So
you
yeah,
said,
go ahead.
that's very interesting. It's great. It tells you where the cancer is. You were saying before we turned this on, like 50 different types of cancers, but
Hmm.
a blood test that can pinpoint where the cancer is, that's interesting.
Right. Well, the mechanism of this is really, Steve, is when how do they find that out in the blood? Is you have to remember, cancer cells release what we call cancer, like dry skin. It's like what we call cell-free cancer cells. So these tumors sheds off cancer cells in the bloodstream, and this is what we find in the detection of the test. And the thing here is, when it's swimming in your blood, we actually try to once we find that cell that dead cancers that die off cancer cell in the blood, they get a sample of that and they actually analyze the methylation patterns. So remember when we talk about methylation, like the B12s, folic acid. So this is how cancer cells grow. They grow through what we call the process of methylation, and that's why the beauty of this test also is it actually determines what these specific patterns or fingerprints on these cells. It actually tells them where it's coming from.
Hmm. So that would tell you what kind of cancer, I would think, right?
That's right. So, and you have to remember 50 of them. And I work in a cancer facility. And majority of these cancers, when we diagnose them, it's already what, stage two, stage three, the worst stage four. And the beauty of this test is it catches cancers in stage one or the most stage two. And this was ran on specific clinical trials already. And the beauty of this is when you want preventative, this is preventative. I mean, of
Yeah,
course, you have cancer already. It's not preventative anymore, but it's preventing you from advancing towards a worse clinical picture.
right. So this will catch it at the early stages.
Right. That's right.
Hmm. Yeah, that's interesting. It might be, worth the $1,000, just to invest in your health, and it's
Hmm.
$1,000 a year. I mean, Yeah, I guess that's a lot for some people,
Right.
but I guess it all depends on how you would prioritize this, right?
Yeah. Well, the thing here is, Steve, when you talk about the results of the test, for example, if you actually say that it's if you see, let's say, a negative, this is a test that actually, when you get a negative, it actually is a very high of a chance that it's actually negative. It's 99% sure that you don't have cancer. But if, let's say, you're the one who got a positive result, I told you it's like a flip of a coin. It's just a yes or a no. If and most of the yeses would be only 1% of all the test takers, and with that 1%, it's only going to be 40% who are actually going to be confirmed that you really have true diagnoses of cancer. That's why, as you can see, it's really good if you find out that you're a negative. But if you're a positive, we need to investigate a little bit more just to make sure that we're not missing anything. But yeah, it's 1% though. See, I don't know if I threw the numbers at you and understand if you understand that better, but that's how
Yeah.
significant this test is.
Yeah, that's, $1,000 for some people. I mean, that maybe are concerned or worry about this, or maybe history in their family. That's $1,000 for what you really want is peace of mind.
Hmm.
So $1,000 is giving you peace of mind and very confidently from what you're saying.
Right. And it only needs a blood draw. So the blood draw, you just go to a lab and you just draw it and you're done. The thing here is, one of the bigger questions that I always get would be, so what type of cancers does it not detect? Because when I say 50, sure, I can go through the list. And yeah, and there's a website already out there that shows you all 50. So that's why the better question is, what can it not detect? So the ones that it cannot detect would be cancers that are pretty super very early stages. Because when I told you, the test is dependent on the shedding of cancer cells. So if your cancer is this small, there's not much to shed. But if your cancer is this big, yes, it has more to give out. Another one would be blood cancers. These would be like leukemia, lymphomas. Those are less on the bottom rung. And then also you also have some cancers that are, again, very rare. Like there are some what we call like sarcomas, but the more common ones it really finds and it actually detects. So it's really handy. And when I see cancer patients, I don't only see those five cancers that I just mentioned to you that are currently being screened right now, but our clinicians. Again, prostate, breast, lung, cervix, and also colon. There are other things that I'm seeing in very late stages that if we could have found at the beginning, man, we could have like stopped that thing on its tracks and the patient would still be alive.
Hmm. Wow. So, as always, you guys listening, if you have questions, put them in the comment section because I always make sure that the doctor sees those questions when they pop up. So, if you have questions on this, put them in the comment section and I'm sure he'll be glad to help you out. So, any last thoughts that you would add to this, doctor, or questions that maybe I didn't ask that people do ask you about this?
Right. Well, probably going to give you share to you some of my experiences with the test. I have patients who actually they already have cancer and they're undergoing treatment and they want to see if the treatment is effective. I tell them this is not the test for that because this is screening, right? You already have cancer. There are other tests for your situation. You can't use that test on those specific patients. Another one would be a good example for you would be somebody who used this test and we actually found pancreatic cancer. Pancreatic cancer, they always show up or you find it in stage either 3 or stage 4. Most of the time a little late, right? But this for this patient, we found it on this test and we actually sent him over to oncology And then he ended up getting surgery and removing that very small cancer in the pancreas, which was actually facilitated by this test that I'm talking about. So I've seen the different uses of this and the different advantages. Again, if you have that spare money for health, hey, this is where you probably want to bank it in and see, especially if you have high predisposition. If your family history is full of cancer left and right on that family tree, it's like showing up like a Christmas tree. You should probably consider this test, and it's going to be worth your money.
Okay. Well, that's great information, Doctor. We appreciate it. And uh, thanks for being with us. As always, we appreciate your insight. You guys, again, check out Biointegrative Health Center in Reno, Nevada. Thanks for being here, Doctor.
Well, Steve, thank you again for having me. As we all know, that our knowledge is your power to better health. And thank you for letting me provide you with angel longevity and health maintenance, which I call the biological edge or the bio edge.